Hello everyone, my name is Anushka Shinde, a volunteer of Shivi Forensic. Today I will be talking about introduction to forensic medicine. In this, today we'll be learning about what is forensic medicine, history of forensic medicine and about death. So, what is forensic medicine? Forensic medicine is the application of medical knowledge to crime investigation, especially when it comes to finding out how an injury or death occurred. This helps law enforcement understand what really happened to a person during a crime. In forensic medicine, there is one important term known as medical jurisprudence, which simply means combining medical and legal knowledge. It's about applying medical expertise in legal settings. It focuses on the legal aspect of medical practice. That means looking at how doctors should act legally while treating patients. Second, it deals with the legal responsibilities of doctor. For example, if a doctor makes a mistake or acts unethically, forensic medicine can help investigate that. And third, it looks at the relationship between doctor and patient from the legal point of view, such as the issues of concern, negligence, or malpractices. Now we will be studying about historical perspective of forensic medicine. This shows how forensic medicine has existed since ancient time. Different ancient texts and code have mentioned legal medical laws and responsibilities. Hammurabi Code 2000 BCE. This was the first legal code that talked about the medical practice and responsibilities. Manusmriti, it described different types of sexual offenses and the punishment for them. Charak Samhita 800 BCE. This was an ancient Indian text on medicine. It explained the duties of doctor and how medicine should be practiced. Sushruta Samhita 700 to 300 BCE. Written by Sushruta, known as the father of surgery. It covered the wound, fractures, poisons and even medical ethics. Arthashastra 4th century BCE. Written by Kautilya. It talked about the medical law, negligence by doctor and punishments. After learning some historical perspective of forensic medicine, let's look into milestone in the forensic medicine. This highlights some important events in the development of forensic medicine both globally and in India. First medico-legal autopsy was performed by Bartolomeo di Vergine in Bologna, Italy in 1302. First forensic medicine was written by Fortunato Fadel, an Italian, in 1802. The first autopsy in India was done in 1963 in Madras by Dr. Berkeley in suspected poisoning case, while the second autopsy in India was conducted by the Dr. Hamilton in Calcutta in 1725. First professor of jurisprudence in India was C.T.O. Woodford. Father of forensic medicine was Paul Jacques, who laid the foundation for the modern forensic medicine. This event shows how forensic medicine has evolved and become a vital part of the legal system. After learning how forensic medicine has developed, let's learn about the death. In death, we will be learning about medical and forensic definition of death, for types of death, stages of death, mode and manner of death. So, what is death? It is described as the permanent and irreversible loss of all vital body functions. These body functions are responsible for keeping a person alive. Death occurs when these functions cannot restart spontaneously even after removing all type of life support like ventilator and meditations. Also, the death is the permanent stoppage of tripod system of body. As we know, there are three tripod system of the body, that is circulatory system, nervous system and respiratory system. These are the three essential systems that help the human body functioning. If all the three stop working permanently, it means the person is dead. The circulatory system, it includes the heart and blood vessels responsible for circulating blood and oxygen throughout the body. Respiratory system, it includes the lung and airways responsible for breathing and gas exchange. Nervous system, it includes the brain and the spinal cord responsible for controlling body functions. If all the three systems stop permanently, it considered the biological death. So now we have studied about death. Now let's see what are the types of death. There are three types of death, that is natural death, unnatural death and undetermined death. So what is natural death? This occurs due to the internal medical condition or malfunction of organs. There is no external force or violence involved. It caused by the disease or age-related health issues. Examples of unnatural death are heart attack, stroke, cancer, etc. Unnatural death caused by external factor or intervention. It involves an act or event that lead to death either by self, other, or by accident. It includes both intentional and unintentional causes. The example of unnatural death are suicide, accidental, homicide, etc. What is undetermined death? When the exact cause of death is not known even after investigation or autopsy. Often used when it's unclear whether the death was natural, accidental, or suicidal or homicidal. These were the three types of death. Now, after studying the types of death, let's look into stages of death, manner of death, and mode of death. So, what are the stages of death? There are two stages of death: somatic death, also known as clinical death. This is the first step of the death. In this stage, the life supporting system of the body stop working immediately. These are systems that are responsible for the somatic death are heart, lung, and brain. When these systems stop functioning, the person is considered clinically or somatically dead. What molecular death, also known as clinical death. This is the second stage of death and it follows somatic death. In this stage, individual cell and tissues begin to die one by one due to the lack of oxygen and nutrient. It happens over the minute to hour depending on the type of cell. Example: brain cells die quickly while the skin cells take longer. While molecular death follows the somatic death in some rare cases like slow poisoning, molecular death can also lead to somatic death. Now, let's start with manner of death. It means how or in what situation death occurred, whether it was natural, planned, or accidental or forced. The example of manner of death are suicide, homicide, accidental, violent death, etc. It also include natural due to the illness or aging, though it's not shown here. Understanding the manner of death is very important in criminal investigation. It helps expert and law enforcement know whether the crime was committed or not. Now, let's look into mode of the death, which refers to physiological or functional cause by which death occur in body. It describes how the vital function failed: brain, heart, or lungs. First one is coma. It is related to the brain and the death due to the brain failure. The causes of the coma are head injury, stroke, brain tumor, etc. It means when the brain stops functioning due to the damage, the person may enter a coma and die if the brain does not recover. The second is asphyxia. It is related to the lung and respiratory system. Death due to the lack of oxygen, and the causes of asphyxia are hanging, strangulation, drowning, smothering, etc. It occurs if oxygen is cut off from the body, the person cannot survive. This is often seen in violent or accidental death. Now let's see syncope death. It is related to heart. Death due to the sudden stoppage of the heart. It is also due to the cardiac arrest. The causes of syncope are heart attack, severe bleeding, stroke, etc. When the heart suddenly stops pumping blood, it can lead to the instant death if not revived quickly. So guys, we have now learned about the forensic medicine. What is forensic medicine, history, and about the death. Now in the conclusion, the forensic medicine plays a vital role in bridging the gap between medicine and law. It helps in uncovering the truth behind unnatural death, injury, and crime. Through the scientific investigation, I hope this presentation gave you a clear overview of its important type of death, manner, and mode of death, and how it supports the justice. Thank you for your time.